Hi, my name is CHURVILL. I'm a nurse practitioner student from South University, and this is Brian. He'll be helping me doing my video assessment for tonight. So prior to doing this assessment, I washed my hands already, and I took some vital signs that I need for this assessment. So his blood pressure is 110/68, heart rate is 64, respiration of 14, height is 5'10", and weight is 198 pounds, and his BMI is 21, which is in normal. Now, to start with, I did some Snellen chart tests already for his visual acuity, and is 20/20, and I did test the Rhines and Weber test. So the air and bone conduction is normal, and the lateralization of air sound is normal. Now I'm gonna start. So how are you today, Brian?
I'm good, thank you.
Can you tell me your full name?
Brian Parker,
How old are you?
48.
Do you know who's the president?
Trump,
Very good. So the patient is alert oriented ×4. Do you know what date is today?
10/27/19.
Very good. Now, this patient is a well-groomed, dressed appropriately for today. No signs of distress. And I'm gonna do inspection for the skin. Now the skin is a normal color for his race, no bruises, no cuts. Hair is evenly distributed. Now I'm gonna go move forward for the head. So I'm gonna inspect the head for symmetry and any tenderness. Is this painful?
No.
So there's no tenderness, there's no bruises, there's no cut in the head. Now in the face, I'm gonna check the face. Can you give me a smile? Puff your cheeks. Very good. Can you clench your jaw? Very good. I'm gonna palpate. Everything's looking good. No, is it painful?
No.
No, okay. Very good. Next, I'm gonna check the patient's eyes using a pen light, okay? So I'm gonna shine a light. Very good. Very good. Now, eyes, the pupils is equally reactive, 2 mm in size. The conjunctiva is in good colors, sclera is white, no unusualities or abnormalities noted. Now I'm gonna, smile for me again. Everything is symmetric, no signs of a neurological deficit. Next is I'm gonna check the patient's ears. Using otoscope, I'm gonna check the patient's external ear. I'm gonna check and assess, inspect the internal auditory canal, eardrum, and the middle ear for any problems. Okay, I'm gonna shine like my ears. Okay, everything's looking good. And the other side, right ear. Very good. So everything is intact, no problem, no redness, anything, no problem. Okay, next we're gonna go to check the patient's nose and sinuses. So first, I'm gonna check the nose for patency. Move your head a little bit. Very good, very good. Can you blow your right ear first? With the other ear. Everything is good and everything is patent and intact. The color of the left and right ears, they are moist, there is no redness, the color is normal. Now we're gonna go check for the mouth and the throat of the patient. For this test, I'm gonna use the gloves and a tongue depressor. So Brian, if you can open your mouth for me. Very good. The mouth, the color is good. It's moist. And open your mouth wide. Very good. The tonsil is not inflamed. The uvula is in the center. And show me your teeth. And very good. Can you show me your tongue? Tongue out, please. Tongue is in the center. The color is good. And that is for the patient's mouth and throat. Now we're gonna move forward for the patient's neck. So for the patient's neck, we're gonna assess the carotid, listen to the carotid for any bruit. So I'm gonna listen first to the left carotid artery. Everything is good, no brewing noted. Now, I'm gonna check the patient's neck movement. If you can rotate your neck in circular motion, and very good. That is, okay, stop. And then move your head forward, and then bend your neck backward, to your left, and to your right. Very good. The patient's neck is in a good range of motion. Now I'm gonna check palpate the patient's lymph node. First, I'm gonna check the patient's pre-auricular and post-auricular occipital lymph node. Is it painful?
No.
Very good. No swollen lymph node noted. Now, after the neck, we're gonna move forward for the patient's shoulder and upper extremities. For this test, we're just gonna pretty much check the patient's shoulder. No lymph node noted. Is it painful?
No, it's not painful.
No, everything's okay. Good. Now if you can take your shirt off so that we can see. Okay, shirt. Very good. Now, I'm gonna check the patient's range of motions in his shoulder. If you can move your hand forward. Okay, pull it down. Move it up to his side. Pull it down. And very good. I'm gonna palpate the pulses. Very good. The brachial pulse is good. It's positive. The left brachial is good. Pulses. The radial is positive too. It's normal. Same. I'll check the right radial. Okay, the right radial is positive too. They're both equal, the right and the left radial. Now I'm gonna check the patient's strength. So I'm gonna let the patient squeeze my hand. Okay. Now using your right hand, if you can squeeze my hand, very good strength. And the other hand, very good strength. Both equal in strength. Now, now for this next one is I'm gonna check the anterior part of your chest, followed by the posterior, checking your heart and your lungs. With this one, I'm gonna inspect first. The chest is in equal movement, it's symmetrical, no signs of distress or any shortness of breath. So I'm gonna listen through the heart valves, okay? We have 4 heart valves that I'm gonna assess: the aortic, pulmonic, mitral, tricuspid and mitral, and the PMI. So in that manner, in that flow. First, I'm gonna check the patient's pulmonic valve. You don't need to deep breathe. Very good. There's no sign of murmur. It's audible. I'm checking the I checked the aortic valve already, so this is the pulmonic valve. Now I'm going to the tricuspid valve, followed by the mitral valve, and followed by the PMI. Very good. So the valve sounds good. There's no murmurs noted. And now I'm gonna listen to the patient's lung fields anteriorly. So now, Brian, if you can take a deep breath in through your nose and out through your mouth. Very good. Very good. Okay, normal breathing now. Very good. Very good. Very good. Now the lungs are clear in front, no advantageous sounds noted in the anterior part of the lungs. Now I'll go next check the patient's posterior side. With this posterior chest, I'm gonna palpate first. If no tactile, for tactile perimeters, very good. If you can lean forward, thank you very much. I'm gonna listen to the patient's lung sounds now. Take a deep breath. Very good. 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 And same thing in the posterior part of the lungs. No advantageous sounds noted. The lungs are all clear. Now, after this one, we're gonna move forward assessing or doing assessment for the patient's abdomen. For the sake of this test, checking the abdomen ideally should be the patient's in a supine position. But for this matter, we're just gonna patient sit on the chair with his both legs on the top of the other chair, doing like this. If he can face the camera, Brian. Very good. Okay. Now, first, when doing assessment of the abdomen, make sure we do the inspection first. The abdomen, as you can see, there is no hernia noted, no scars, no keloids noted, no skin. Skin is intact, no bruises. Now I'm gonna auscultate for a bowel sound and auscultate for the iliac arteries, the abdomen, everything. You don't just breathe normally. I'm just listening to your bowel sound in all 4 quadrants. And very good. And very good. And very good. Now I'm gonna auscultate to your renal and iliac artery. Very good. Very good. Now, followed by auscultation, I'm gonna do percussions. First, I'm gonna percuss in all 4 quadrants of the abdomen. And I'll follow percussions to the liver. Very good. And followed by palpation. I'm gonna check palpation. This is a light palpation so far. Any pain? No. Now I'm gonna try to do rebound tenderness in the left side. Let it go. Any tenderness?
No.
No pain?
No.
Very good. Now I'm gonna check for a SWA sign. So if you can lift your leg right here. No pain in your abdomen?
No.
Now if you can bend your knees. Very good. No pain?
No pain.
No pain. Very good. So negative for SWA sign or obturator signs. Now, after checking the abdomen, we're gonna check the bladder if it's distended, but the patient voided already prior doing this assessment. So I'm gonna check the bladder. Bladder is not distended. Is it painful?
No.
No, very good. Now we're gonna move forward to the lower extremities. So I'm gonna let Brian stand this time so that we can see and assess the patient's hip for the range of motion. So for this test, I want you to move backward a little bit. Now for the lower extremities, so the hip, there's no edema noted, no deformity. Now I'm gonna check the patient's hip range of motion, if you can rotate in circular motions. Very good. If you can bend to the left side, very good. To the right, go back to the left again, and to the right. Very good. And that's for the hip. Now we're gonna move forward to the patient's knees. So now if you can bend your left knee, very good. Bend. How about your right knee? Okay, very good. For your right knee, can you hold your, if you can rotate?
Like that.
Yes, very good. How about your left knee? Very good. Hip is in a normal range of motion, no painful while doing the rotation, bending, and extension of the knee. Now we move to the patient's ankles. Now if you can move your foot in circular motion, I'm gonna hold you. Very good. How about the other side? And very good. If you can point your toes forward. How about the right foot? Very good. I'm gonna lift your right leg. I'm gonna check the patient's strength. If you can resist it, very good. Good strength. How about the other side? The same thing. Both right and left leg are in good strength. Now, Brian, I want you to, if you can walk 4 steps towards the camera.
4.
Yeah, 1, 2, 3, 4, and go back in heel to toe, walk, and go back to your original position. Heel to toe, heel to toe, heel to toe. Very good, and face towards me. Everything is everything is normal. Patients is not dizzy. Good balance, and and that is it for our. Thank you, Ryan. You can sit down. So that is the summary of my head to toe video physical assessment. Thank you.